Okay, let us now continue to the second part of our topic. So in this topic, we'll be discussing the basic terminology or the anatomical terminology. So scientists and healthcare professionals use a common language of special terms when referring to body structures and their functions. So the language of anatomy they use has precisely defined meanings that allows us to communicate clearly and precisely. So this language of anatomy are special terminologies used to prevent misunderstanding. So exact terms are used for position, direction, regions, and structures. So let us now describe all of these anatomical terminologies or the language of anatomy. The language of anatomy. So first we have the body position. So descriptions of any region or part of the human body assume that it is in a standard position of reference called the anatomical position. So in the anatomical position, the subject stands erect, facing the observer, with the head level and the eyes facing directly forward. The lower limbs are parallel to the feet, and the feet are flat on the floor and directed forward. So the lower limbs are parallel and the feet are flat on the floor. And the upper limbs are at the sides of the palm. So are at the sides of the palm. With the palms turned forward. So this is your palm, it is forward, turned forward. So your upper limbs are at the sides with the palms forward. Then next, we have the regional names. So regional names is divided into, or the human body is divided into several major regions that can be identified externally. So the principal regions are the head, the neck, the trunk, the upper limbs, and the lower limbs. So for example, if you receive a tetanus shot in your gluteal region, so what part of the injection will be put or what part will be injected? So your glutea will be on your buttocks na region. So if makakaroon ka ng tetanus shot dyan, so it will be on your buttocks. For example lang. So we will memorize all of these terms, these regional and directional terms. So for example, we have the cephalic, which is composed of the head, so cranial, skull, the facial face, neck, cervical is the anatomical terminology, armpit, axillary, arm, brachial, front of elbow. This one is the front of our elbow, antecubital. Forearm, that is antebrachial. The carpal or our wrists. Palmar or volar, our palm. Digital or phalangeal, that is our fingers. That's the other term for fingers. Then we have femoral or the thigh. Patellar, so anterior surface of the knee. When we say anterior front. Then posterior back. Then crural, that is your leg. Then your ankle is tarsal. Your toes are digital or phalangeal. Then pedal, foot. So forehead, frontal, temporal, temple. This is your temple. Orbital, your eyes. Ear is your otic. Cheek is buccal. Then nose, nasal. Mouth is oral. Then your chin is mental. Then here is your breastbone, sternal. So when we say chest, that is thoracic. Your breast is mammary. Navel is your umbilical, yung pusod. Then hip bone or your hip part is your coxal. And your groin or your singit is what you call as inguinal. So your thumb is pollex. Then your head is called as manual. See, in your pubic area, that is your pubis. So that's for the anterior view. Sa posterior view naman, these are the regional names. So we have occipital base of your skull. Your shoulder blade is scapular. Your spinal column is your vertebral. We have also the back of your elbow is olecranal or cubital. Then your between hips is what you call as the sacral, and your loin is your lumbar. So gluteal, we have your buttocks. Perineal, that is your region of the anus and external genital. So this is your perineal area. Popliteal at the back of your knee. Hollow behind knee. Then your bagtak, your cap is what you call as sural. Then your sole is what you call as plantar. Calcaneal is your heel. Then your back of the head is what you call as dorsum. Cervical neck, cephalic head. So these are the different regional terms. So posterior, that is your back view. So let's proceed now to so this is the anterior body landmarks, as what I have mentioned earlier, and their position and their locations in the body. We have the posterior, we have from the back portion. Then the directional terms. So we say directional to locate various body structures. Anatomists use specific directional terms, words that describe position of one body part relative to another. So most of the directional terms used to describe the relationship of one part of the body to another can be grouped into pairs that have opposite meanings. For example, superior and inferior. So when we say superior, that is cranial or cephalad, that is above. Means toward the upper part of the body. On the other hand, we have inferior. We say inferior, that is caudal, which means below, towards the lower part. Same with anterior and posterior. Anterior, front, and the opposite of that is posterior, which is the back portion. So, anterior, front, posterior, back. Superior, above, inferior, below. So that is directional terms. Another example is ventral. So same with anterior, ventral toward the front of the body. But note that the terms anterior and ventral means the same thing in humans. So however, in four-legged animals, ventral refers to the belly side and it's therefore inferior. Similarly, the term posterior and dorsal mean the same thing in humans. But in four-legged animals, dorsal refers to the backside and it is therefore superior. In that is the case of the animals. But in humans, ventral and anterior are just the same position or the same direction. So that is ventral. This is now dorsal. And another is the medial, the lateral, and intermediate. I will give an example of this later. So we have medial toward or the midline of the body, lateral away from the midline, intermediate between a more medial and a more lateral structure. So in between, that is now in between, intermediate, a more lateral or medial. We also have this directional terms of proximal and distal. We say proximal, close to the origin or point of attachment. We say distal, farther from the point of attachment. An example of that is the phalanges are distal to your carpal. So you have to memorize all the terms. Saan ba yung carpal, saan yung phalanges ninyo? And superficial towards the body surface, deep away from the body surface. It is more internal. Okay, so Now make it easier to understand the topic about directional term. So I've given this table. So you have to have a copy of this. So superior, as what I have said, cephalic or cranial, it is toward the head or upper part of the surface above. Example of this is the heart is superior to the liver. Inferior caudal away from the head or the lower part of the structure below. The stomach is inferior to the lungs. Next, anterior front or nearer at the front. Posterior at the back of the body. So anterior, the sternum is anterior to the heart. So the sternum is in front of the heart. Posterior, nearer to the back of the body. So the esophagus is posterior to the trachea. The esophagus is posterior to the trachea or the windpipe. Medial refer to the near to the midline. We have the ulna is medial to the radius. So you really have to know where is ulna and where is radius. Lateral, farther from the midline. The lungs are lateral to the heart. The lungs are lateral to the heart. Napagitnaan ang heart ng dalawang lungs. Farther from the midline. Intermediate. So between two structures. So the transverse colon is intermediate to the ascending colon. Example of that is, look at this example. This is the ascending colon and this is the descending colon. So the transverse colon is what? Intermediate with the ascending and descending colon. So that is what you call as intermediate between two structures. Ipsilateral, when we say ipsilateral, on the same side of the body as another structure. So on the same side. So the gallbladder and the ascending colon are ipsilateral. They belong or they are located on the same side of the body. Ipsilateral. When we say contralateral, on the opposite side of the body. So for example, the ascending and the descending colons are contralateral. Next, we have the proximal. So when we say proximal, near to the point of attachment, so your arm bone is proximal to the radius. So the humerus is nearer to the point of attachment to the radius. Then distal will say distal, farther from the point of attachment. So your fingers are distal to the carpal. So where are your carpals? Wrist bones. So your wrist bones or your carpals are nearer to the point of attachment than the phalanges. So that is the difference between proximal and distal. So we say proximal, mas malapit doon sa point of attachment. Saan sila na-attach? And we say distal, mas malayo doon sa point of attachment. So nakuha, example of proximal, so yung humerus or your arm bone is proximal to the radius. Mas malapit ang humerus kaysa sa radius sa point of attachment natin. On the other hand, distal, farther from the attachment of limb to the trunk. So the phalanges are distal to the carpals or wrist bones. Next, we have the superficial. We say superficial toward on the surface of the body. So the ribs are superficial to the lungs. So the ribs are nearer to the surface of the body than the lungs. Deep, so internal, away from the surface of the body. So but the ribs are deep to the skin of the chest and back. So we say superficial, external. We say deep, internal. So we really have to understand all these terms. And prior to that, you have to memorize and familiarize those regional and directional regional names of the human or the anatomical terminology so that we will not be having trouble in giving their direction. So for example, the gallbladder and the ascending colon are blank. They are what? Ipsilateral. So that is now the directional terms. So directional terms are precisely locate various parts of the body relative to one another. So any questions about this one, you can if there are questions, if dili masyado masabtan, dili masyado maintindihan itong directional terms, you can PM me or you can watch some videos on YouTube. Okay? So kindly memorize all these terms and also do not forget to familiarize the different regional terms, the one that I have mentioned a while ago. The next proceed to the body planes and section. So what are these body planes and section? So in this topic, we will also study parts of the body relative to planes. So what are these planes? These are imaginary flat surfaces that pass through the body parts. Imaginary lang siya. Imaginary flat surfaces. So we have this one. We have three major body planes and section: the sagittal, and we have the frontal, and we have the transverse planes. So ito yung mid-sagittal. So when we say mid-sagittal, when we say sagittal, sagittal section divides the body or organ into left and right parts. So when we say a median or a mid-sagittal section divides the body or the organ into equal left and right. So we say sagittal, left and right body lang. Ang medial or mid-sagittal, equal left and right parts. Equal left and right. If not equal left and right, that is now called as parasagittal. So sagittal divides left and right. Median or mid-sagittal divides equal left and right parts. Parasagittal divides unequal left and right sides or left and right parts. Next, we have the frontal or the coronal. So this section divides the body or the organ into anterior and posterior parts. So the upper part and the lower, the front part and the back part. I will correct myself. So frontal and coronal section divides the body into anterior and posterior, the front and the back parts. Transverse or cross section divides the body parts or the organ into superior and inferior. The superior and inferior, that is the transverse. So the upper part and the lower part. So this picture shows the mid-sagittal. As what I have said, if section divides into equal left and right, that is mid-sagittal. So if not equal, that is now the parasagittal. For example, this is an example of the mid-sagittal section. And this is now the coronal or the frontal. So it divides the body into anterior and posterior, the front and the back. Then we have the transverse plane. So it divides the body, imaginary divides the body into superior and inferior, the upper part and the lower part. That is the transverse plane or the cross-sectional plane. So that is for our planes and section. So frontal, transverse, sagittal, and oblique planes divide the body into specific ways. Then next, we have the body cavities. What are these body cavities? Body cavities are spaces that includes or that enclose internal organs. These are there are spaces that enclose our internal organs. So bones, muscles, ligaments, and other structure separate the various body cavities from one another. Here we discuss several body cavities. So first we have the dorsal body cavity, we have the cranial and the spinal. So we say cranial cavity, so it houses the brain. The spinal cavity houses the spinal cord. The ventral body cavity, we have the thoracic cavity houses the heart, the lungs, and the others. Abdominopelvic cavity houses digestive system and most urinary system organs. So we will have a summary of this. So this is the cranial, this is the dorsal, and this is the ventral body cavity. So this is the cranial cavity, this is the spinal cavity. This is thoracic, and this is the abdominal cavity and the pelvic cavity. This is collectively known as abdominopelvic cavity. So we have these major cavities of the trunk or the thoracic and abdominopelvic cavities. So in the cranial cavity and vertebral, or the spinal, so cranial houses the brain, the cranial bones, vertebral canal, forms vertebral column, and contains spinal cord and the beginnings of the spinal nerves. So this one. The thoracic cavity includes what? So thoracic cavity includes the pleural cavity, the pericardial cavity, and the mediastinum. So pleural cavity contains what? It's a space between the layers of the pleura that surrounds the lungs. So dito yan siya, surrounds the lungs. Pericardial, a potential space between the layers of the heart. So dito yan siya, between the layers of the heart. That's between the layers of the pericardium that surrounds the heart. Then the mediastinum is the central portion of the thoracic cavity. So central portion, that is now the thoracic cavity. Abdominopelvic cavity, it comprises of two. We have the abdominal and the pelvic. So dividing into two, abdominal cavity contains these organs. You have the stomach, the spleen, the liver, the gallbladder, the small intestine, and most of the large intestine. The serous membrane of the abdominal cavity is the peritoneum. Pelvic cavity. So we say pelvic cavity, it contains the urinary bladder, the portions of large intestine, and internal organs of reproduction. So these are the major body cavities. So we say cavities, these are spaces that enclose our internal organs. Now let us now proceed to the regions and quadrants of the abdominopelvic cavity. So there are 9 regions. A 9-region designation is used for anatomical studies. That quadrant designation is used to locate the site of, for what? That is used to know the location of the site of pain, tumors, or some other abnormality. So we have the 9 regions. So we have the right hypochondriac region on this side. We have the epigastric region and the left hypochondriac. Right lumbar region, the umbilical region, the left lumbar region, the right inguinal region, the hypogastric region, and we have the left inguinal region. So these are the 9 regions used for anatomical study. So the quadrant designation is used to locate the site of pain, tumors, or some other abnormality. So for example, we have the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. So these are very helpful for you to know or to easily know the different anatomical terminologies. So we have example for clearer picture. So this is the RUK. So in this area, right upper quadrant. This is the right lower quadrant, left upper quadrant, and the left lower quadrant. So to describe the location of the many abdominal pelvic organs more easily, anatomists and clinicians use two methods of dividing the abdominopelvic cavity into smaller areas. So in the first method, so they use different methods in dividing the abdominopelvic cavity. So there are four lines divide the abdominopelvic cavity into larger middle section and smaller and left-right section. So what I have discussed this one is ito yun siya. The second method and divides the abdominal cavity into quadrants. So these are, in this method, a mid-sagittal line and a transverse line are passed through the umbilicus and to umbilicus or the belly button. So dalawang line lang, ito apat na lines. So clinicians and anatomists use these two methods in dividing the abdominopelvic regions. So that's for regions and quadrants of the abdominopelvic cavity. So that's the end of our first topic or the first chapter. So if there are further questions and clarifications, you can always go back to this video or look for another video on YouTube. And always remember this one, please